The red flag law is being billed as an attempt to stop mass shootings, but it could save even more Americans from suicide. A new study from the University of California, Davis found 373 people died in mass shootings in the U.S. just last year. But more than 47,000 Americans commit suicide annually, and guns are used in more than half of those suicides.
Because we see these things before many other people do, and there's a chance for us to intervene.
All new at 5, News 5's Emily Hamilton spoke to a local doctor who says lawmakers need to act to combat suicides and prevent mass shootings. She joins us live now with more. Emily.
Frank, under a proposal by Senator Marco Rubio, a family member or law enforcement officer could petition a court for a protective order to take away guns from someone believed to be an imminent danger to themselves or the public. But Cleveland Clinic Dr. Brian Barnett believes doctors, too, should be able to sound the alarm on patients they believe could pose a threat.
This legislation would not create a federal red flag law, but would instead give states grants to exercise these protective orders when dealing with people with mental illness. A local gun rights advocate supports the idea, but says this is easier said than done.
There's the mentally unstable people. I think that's going to be our biggest hurdle, because what are you going to use to determine that? But
Cleveland Clinic Dr. Brian Barnett, a psychiatrist and gun owner himself, says the Extreme Risk Protection Order and Violence Prevention Act is crucial.
We screen all the patients who come through for gun ownership because it's a very important risk factor for suicide.
Barnett regularly treats suicidal patients, but says once a patient is discharged, his hands are tied.
Most of those laws leave out mental health practitioners. And as people who regularly work with those who are suicidal, I think it's important that we have a say in this matter because we see these things before many other people do, and there's a chance for us to intervene.
Some states already allow doctors to take these measures, but Ohio currently does not. And Barnett believes adding mental health care professionals to Rubio's proposal would benefit public safety by keeping guns out of the hands of people dealing with psychological trauma. An Ohio Democratic Representative, Juanita Brent, who supports red flag laws, said stricter supervision is long overdue.
The process is moving too slow, and lives are being lost in this process. Even though most people who will fall underneath the red flag laws would not be people who would be, a threat. They're not normally people of mass shootings, but they pose a threat to themselves, their family members, and also to their community. So we want to make sure there's a process.
And it's important to note these protective orders would mean temporary restrictions like taking away guns from potentially dangerous people. Now, during that period of risk, that person would also not be allowed to purchase a gun. But when that period is over, that person wouldn't be placed on any type of permanent national watch list. Live in the newsroom tonight, Emily Hamilton, News 5.